Hello everyone, and welcome to the next in our series of best practice workflows. Today we're going to cover reaching out to patients with specific conditions or multiple conditions. Your presentation team today is myself. I'm Dr. Jen Bolduck, Vice President of Population Health, and Brian Sowers, Senior Product Manager Extraordinaire, who is running the show today. All right, so let's go ahead and get started with the scenario. So today we are going to talk about finding patients who have a physical condition, a behavioral health condition, and now new to the platform, a social determinant of health. So Brian, if you will go ahead and navigate to condition registry, we'll show you how that works. So we are going to go ahead and select conditions. We're going to deselect hypertension and coronary artery disease. And as Brian has already started with depression, let's add that. And then we're going to move on to our social determinants of health. And I'm going to pause there for a second once he clicks on homelessness, just to point out that these are the 4 new social determinants of health registries that we have: homelessness, inadequate housing, lack of adequate food, and unemployment. Then we're going to view the intersection of these conditions. So here we have a physical condition of diabetes, we have depression as the behavioral health condition, and then we've selected homelessness in our demo system here. And we found that there are 8 patients who have all 3. So we'll go ahead and click on that group of 8. And then from here, that's the intelligent insight that we're generating, right? We've got these 8 patients with these 3 conditions, and we're going to go ahead and export that list to the EHR, to NGE, so to take action upon them. So we're going to move over now to the EHR.
Great. Thanks, Dr. Jen. So again, now pretend I'm the nurse, the doctor, the care manager, whoever, and I'm inside the NextGen EHR. And I can receive that list, and I can quickly come here to go to our integration touch point for Pop Health, which we call the hub. So here I can go ahead and import that list, and then I can go ahead and take a look at those 8 different patients. So I can do all kinds of different actions, but maybe, we want to, since they're homeless, we would like someone to call and follow up with them. So I can easily come here in task, maybe to my nursing group. So I can come here real quick and select from my task groups that I've already set up and go ahead and grab the nursing group. And then I can go ahead and let them know what to do with this list. I can go ahead and put in a little message here. Please call, assess current status and need. So I can go ahead and send that task to the nurses. They'll go ahead and follow up on these 8 patients to check on them.
Right, and what we learned from our clients who have behavioral health, this is, being able to look at patients in this way is really helpful. Just knowing, with the addition of knowing that they're homeless, it changes the intervention tremendously, right? We could send them an email and we could send them a text, but like Brian pointed out here, the more effective intervention is to contact these patients directly. We have to have more of an effort. They require a higher level of intervention than someone who is not homeless, who is more contactable. So that's the reasoning there. Great, Brian. So what we've shown you today, right? We've shown you how to find groups of patients who have a physical, behavioral, and social determinant conditions, and targeting interventions appropriately for that group of patients. Thank you.